It is National Walking Day. Dr. Raj Kattar is here from Promedica with why the simplest form of movement can yield the finest results. Good morning. Thanks for joining us today.
Good morning. Good morning, Amanda. How are you?
Absolutely. Good. Thank you. First of all, let's talk about heart disease. It is still the #1 killer in America. And, there is a way to prevent it. There are a few things that people can do. But let's talk about how big of an issue it is here.
So, clearly heart disease, having heart attack, stroke is really one of the heart attack is still one of the leading causes of death. And a lot of patients and a lot of people ask me, what can I do? You may have a family history of heart disease. You may have risk factors such as high blood pressure, high cholesterol, diabetes, smoking. And what I always emphasize is what is something that you can change? What's modifiable? So clearly, exercise, diet, and quitting smoking are the keys. For instance, smoking multiplies your risk by 2 to 4 times, if not even more. And there have been some key studies, one done by the Mayo Clinic, for instance, a 10-year study, where basically if you exercise 30 to 45 minutes 5 times a week with aerobic type of exercise, you can reduce your chance of a stroke or a heart attack by 30%. 30%, that's better than any medication. So I think that's the key, is what can you change and what you can do to be proactive about preventing this.
Yeah.
Because I've had a lot of patients say, well, my dad had this, my mom had this, what's the point?
Right.
Well, that's not really the case. You can have a large role in your health and preventing heart attack and stroke.
And, one way to get started is walking in your neighborhood, and today is a great day to do that. We've raised awareness for that with National Walking Day. What are some of the positive impacts overall to our health?
So obviously preventing heart attack and stroke, but mentally, I think when it's really interesting since the pandemic, I myself, I used to do a lot of exercise indoors, but I actually started walking more, mixed in with my higher intensity exercise. And I've kind of felt like mentally it's kind of helped me. And I think it helps you feel good about yourself. There's endorphin release, so you actually feel more energetic once you get out there and walk. Walking let's say you're at risk for diabetes. It actually can reduce the chance of the diabetes affecting you. It can improve your blood sugars. Also, one other underrated portion of this is actually getting out there and walking strengthens your muscles. And I think what happens when you get older, you have if you start this at a younger age, you have a much larger chance of being able to exercise way into the future, into your 70s, 80s, 90s even. I have a lady who was training for a 5 or 7K just the other day in the office. So I said, you're ahead of the curve.
Wow.
And she said, well, I've been doing this my whole life,
Good for her, setting a good example, getting started early. Another way people can, get involved and get up and walk. There's an event coming up for the Northwest Ohio Heart Walk that's coming up. Tell us a little bit about that.
Yeah, so the Heart Walk is Saturday, May 14th. It starts at 9 a.m. and check-in. You have it up there 7:15 a.m. The importance of this is not only are you getting out there for your own health, but by participating, you're helping fund research dollars towards preventing stroke and heart attack. And I cannot emphasize how important that is. I mean, you're actually helping your other community members, family members, just by participating in this. And if we can get everyone out there to do this, it would be great, because it really shows support for each other. And the research is very important. A lot of major things have happened in a positive direction in the last decade or 20 years by research into preventing heart attack and stroke. So
you could be part of that.
Participate.
Yeah. So mark that on your calendar. That is May 14th. Again, Dr. Kattar, thank you so much for joining us this morning. And, get the raincoat on or the umbrella out there today, maybe to dodge those raindrops, but get outside and walk today.
Exactly. Yeah.
Take care.